constituents with the tax cut.
We expect to hear a lot more about that. Virginia Congressman Randy Forbes is on the Judiciary Committee. He's part of that debate. And, sir, good morning to you and welcome back to America's Newsroom.
Good morning, Bill.
We heard a sample there. What does this vote get you?
Well, Bill, first of all, it's what it gets the American people. Right now, the American people, the economy is the #1 issue for them. They've looked over the last 41 months and had over 8% unemployment. They've seen a net loss in this administration of 473,000 jobs. And this health care bill, according to the Congressional Budget Office, will cost us 800,000 jobs. Their defense cuts will cost us another 1 million. And, Bill, if you start cutting 1 million here and 1 million there of jobs, you look out the window, and that's why we're in the economic mess we're in now, and we want to stop this hemorrhaging.
Yeah, what is your sense about how many Democrats will vote with Republicans on this?
You know, I think we're going to find a lot of individuals who cross lines today and say that this is not a partisan issue, that they realize how bad this bill is, that it was represented as one thing, and now they've come out when they said it wasn't a tax. Now they know it is a tax. When they've said it's going to lower health care costs, it's raised health care costs. When they said that it wouldn't cost jobs, it has. When they said that people could keep their health insurance, they now find out that they can't. So I think you're going to find a lot of Democrats joining with Republicans to try this effort to repeal it.
Is that 3 Democrats? Is that 30? Do you have a number?
Bill, obviously we don't whip the Democrats, so we can't tell. But I think you'll have at least a dozen or more Democrats. There could be 2 dozen of them that cross those lines, and I think it will definitely be a bipartisan vote.
You know what the White House is saying already. They'll veto this thing if it even reaches the desk of the president, because it's not likely to get there because it won't be brought up for a vote in the Senate. And Bill, the suggestion from the other side is that this is just an act of futility. What would you say?
Well, Bill, I think anytime you're trying to save 800,000 jobs, anytime you're trying to save a health care system, it's not futile. And I think what it's going to point out to the American people is if they really want to get rid of this bill, we've got to get rid of the current Senate leadership, and we've got to have a change in the White House, and I hope that's coming in November.
Is your sense that the longer the Affordable Care Act is in place, that it will gain more support? And I asked you that because I just saw a poll bit earlier today that suggested it's even. It's like 48 to 48 about those who support and those who are against it. In the past, those against it was slightly higher. What's your feeling on that?
Well, Bill, I think it's going to be exactly the opposite. When the American people realize we're already seeing as many as 70% of our doctors are thinking about leaving practice if this system stays in place. We're looking at adding another $500 billion of taxes to the American people, $500 billion of cuts to Medicare. The more the American people truly realize that, I think their dissatisfaction for this bill is going to go up. And I think they realize that we want to improve the health care system, but we can do it in ways to find common ground without having to have a system that's going to cost us almost 1 million jobs.
You know, you think about your home state of Virginia. You know, President Obama won there in 2008. That had not been done by a Democrat in 40-some-odd years. Now, what are your constituents telling you? Do you think you're on the right side of this repeal bill?
Well, our constituents are very, very concerned about the economy, and they realize that this is a president that's had a net loss of 473,000 jobs, as we mentioned, Bill. But the big concern with the health care bill is the number of jobs it's going to cost, and they're very concerned about making sure that we maintain the doctor-patient relationship. And when you have this many doctors that are this dissatisfied with this health care system, it merits us stepping back and giving it another look, and that's what we're going to do. But also our constituents are concerned about the pattern. Again, 800,000 jobs lost from this, 1 million jobs lost from defense cuts.
Right.
That's what I think is going to change the tide in Virginia.
Sir, thank you. Randy Forbes, Republican from Virginia. Appreciate your time. We'll be waiting for the debate and then the vote. Thank you. What do you think at home? Our question of the day on our